I'll make a confession, I don't actually come to many events now. Basically because you've got people saying the same old thing, the rhetoric of people-powered co-production, we're all in this together, which aren't a reality. And the reason I'm here is because of my enormous respect for the team who have put this together. So there's something in all of this as we're moving forward and being visionary. It's about connections and relationships. It was the lure of Victoria, Anne, Michael, Mark and Kat who got me here. And also, because I know them, I understand that they have a commitment to people-driven digital health and care. And like Tim, it's not about digital. It's actually looking at what are the problems that need solving. And let's start, with the sort of the basics rather than, and I advise a lot of tech startups. And I have to say sometimes I think they're solutions in looking for a problem to solve. So we've got to get real. And part of that, Tim and I were having an interesting discussion about the endorsement and accreditation of apps. And it's a very tricky, thorny issue. And something that I think a lot of us have got to be involved in bringing our own expertise to bear. And just as a sort of bit of a crowdsourcing, what I would like to invite people here to do, Mike Clark asked a question yesterday, what are the 3 care, health, well-being apps that you would recommend to the world? And I was thinking about this coming up here, because clearly I've got to do this, Mike and I collaborate. And I thought, for me, the 3 that I would recommend are Twitter, because it's connected me to the most amazing people. It's the way I keep up to date with the latest innovations that are happening, and because it's a constantly refreshing source of inspiration and frustration as well at times. And I was thinking the second one is Jawbone. I don't actually have my Jawbone on because I've lost it. But that whole, if you look at the market valuation of Fitbit, it's phenomenal. And it's really, really simple. And there are NHS Fitbit clubs, there's sort of little groups of us who all share, our exercise, or lack of it. But the point is, we all need motivation. And it's how you get people motivated. And if it's a game, if it's a band, whatever, then that's the way forward. Doesn't need complicated solutions. So my first request of you tonight is share. We'll gather them all in the tweets and we'll put them out, crowdsource the apps that you would recommend that you use. I've actually stepped in at the last moment for Jen. And of course, if she was talking about Big White Wall, she'd be talking about the success of what she's done. But I've spoken to her team, I've watched the way that they have evolved and developed, and hey, let me tell you, it doesn't happen overnight. There may be an element of luck, but there's a lot of tenacity, because one of the realities, and I know Tim is trying to resolve this, is access to the NHS for innovators. It's a minefield. So on the one hand, we want to innovate, we want new things coming in, but what I'd like to see us looking at over the next day are the barriers and how we can overcome them. Maybe the reality is that we can't. Maybe we need to go straight to the consumer market. Maybe we need a totally different model. And what fascinated me in looking at different models, one of the reasons I like Twitter is because you can connect with a phenomenal amount of people. And over the weekend, I read about, and keep your fingers crossed on this one, a Silicon Valley startup that had attracted $20 million. And it's a home care startup. It's called Honor. And I was really interested in their business model. Because on the one hand, it's a question I often ask. There may be a gap in the market. Is there a market in the gap? Who is going to pay for the services or the products or the apps that you're actually selling? And that's where a lot of people seem to fall at the first hurdle. And their business model, two really, so I ended up in 6 tweets talking to one of the co-founders. That's the power of Twitter, about how you can make connections. And so we were talking about the philosophy behind what they were doing. And there seemed to be two things. One, that they were taking out the transaction costs. They were using digital to actually take money away from the admin so that they could pay care workers more money. And secondly, that they were taking control of the training and support of care workers. So it wasn't just a sort of app that did this. They were looking at the whole process from someone needs care, how can we guarantee the care, how can we use digital to make it cheaper, and how can we continue to quality assure the process. And there were two things I asked, not just of Seth, their co-founder, but in this country, okay, so how much does it currently cost to commission 15 minutes of care? What are the transaction costs? Because I suspect they are considerably more than the money that we are paying the care workers. So we have to radically review the way that things work at the moment, and we can do it through digital. The other acknowledgement I make is that digital is not a magic bullet. If you put digital onto broken systems, they're not suddenly going to transform things. That's the reality. And so we've also got to manage people's expectations about digital transformation. A secret that Victoria mentioned, I would talk about connected care, because that's the future. If you actually start with a citizen, I have to say this, from the hundreds of people I've talked to, they don't actually care who delivers it. What they want is a quality service. And they want it connected. They don't want to tell their story to 14 people. Well, who of us would, quite frankly? Why can't we get the basics right? Can digital help us? Because that is a transaction cost. You know, if you're having to go to the hospital, if you're having to talk to this person, you know, my aunt required care, and we had 14 different agencies to work with. Now, how much is that costing each of us? There's got to be savings to be made, and a better quality of service. But a little secret I have shared with the esteemed Simon Stevens about the 5-year forward view is that there seemed to be a dearth in it of any mentions of social care, housing, the wider social sector, that vision cannot be delivered without engaging considerably more people than health. The medical model is broken. We need a social model, and that's part, paradoxically, of the technology, the digital transformation. So that's quite exciting. This is a very brief introduction, so I'm going to finish with one of my favourite subjects, robots. Now, I don't see any robots here tonight, but Mike, Paul and I track robots. You think, well, what have they got to do with care? And I have made the public statement that I would rather have a robot companion than 15 minutes of indifferent care. They have a role, but the bigger role, and the challenge I think everybody, you know, we've got a fine collection of minds here today, is to how can we make this new digital world that we're all part of exciting, sexy, And what I can assure you is that robots get people talking on a whole number of different levels. So I do think, actually, there is a role for robots in the future. It is in the long-term future. I have Mike to remind me of the practical considerations. But so much of digital in the healthcare and housing world basically is boring. It's a real turn-off. So there's something about the language we use and the total paradox that we are not using technology to connect all of these things going on. So I look at the hundreds of organisations involved in the digital space. I look at the thousands of innovations that are there today that we could be using to transform communities and individuals' lives next week. Doesn't need a year, next week. Put aside the considerations about their validity and accreditation, but there is so much exciting going on. And then you go to meetings in health and care, and you get overwhelmed by PowerPoints and reports that are not exciting. So there's something here about how we need to bring everything together and make it easy for people to access stuff that is going to make a real difference to the quality of their lives. It's a fascinating thing, you know. Social media has democratized access to information. And one of the challenges, of course, for organisations is that it's leading the public to have greater expectations of transparency, accountability, and openness. And the social space, whether you feel comfortable about it or not, is going to be one of the key areas where new, exciting developments happen. And so I think I'm delighted at all the people who are tweeting. Can I just remind you of a hashtag, PDDigital15, because it's not just about us 100 people, whatever, in the room today. If we did a quick tally of all of our followers, potentially we could have 1 million people involved in this conversation. That's the power of social. So thank you. I'm delighted to be here today.